My name is Ashley Wisdom. I am the CEO and co-founder of Health in Her Hue. I graduated from NYU GPH in 2018 with my master in public health with a concentration in healthcare policy. I'm leveraging the power of technology, media, and community to improve health outcomes for Black women and other women of color. So the work that I'm doing with Health in Her Hue is really focused on making the healthcare system more equitable by tailoring solutions to those who have been most marginalized by the healthcare system and who are the most vulnerable. I believe that when you design solutions for those types of people, that it ultimately benefits everyone. And so with Health in Her Hue, I'm specifically building and designing a solution to meet the nuance and specific needs of Black women primarily to start, but over time we plan to expand to other demographics of women of color. So that is the way that my work is really helping people. Having the education that I have and really understanding the inequities in the healthcare system at both a macro and micro level, I'm able to approach innovation from an equitable standpoint. I'm centering equity, health equity, in everything that I am doing as I'm building Health in Her Hue. And so by having this degree, I'm not just building a nice to have solution. I'm really trying to think about the ways in which, as we build it, that we can be as inclusive as possible and reach as many women who are in need of the solution that we're building. Building the right team to execute on this vision is my job as a CEO. You can have the great idea, amazing vision, amazing roadmap, but if you don't have the right people to build it with you, then it's probably not going to come to fruition. So right now, my main job, or the most important part of my job right now, is making sure that I have smart people who are smarter than me, helping me to bring this vision to life into the world. This work that I'm doing now came from a place of genuine frustration, personal frustration that I needed to channel into something constructive and productive. So to see, how I took that energy and channeled it into a solution, and seeing how, even though we're just getting started, how impactful the early work that I've been able to do with my team has been impactful to women. It's the most fulfilling thing that I could ever experience. I would 100%, 1,000% recommend the public health program at NYU. The global perspective on the education, I think, is definitely a benefit that NYU offers. Even having the ability to study abroad, to learn about other healthcare contexts, like me studying abroad in Cuba, really challenged the way that I think about healthcare within the US context. And the professors, they're just really passionate about training and equipping the next generation of public health leaders. So I think you get so much from the experience of getting your master's in public health at NYU. There are just so many different opportunities in New York City, especially from a public health professional perspective. You can work for New York City Health and Hospitals and intern there. You have the New York City Health Department that's there. And then you have all these leading premier health institutions like Weill Cornell Medicine, Columbia, NYU. So you're just in this prime location for opportunities, internships, actual jobs, in addition to getting your education from one of the best institutions in New York City. And I'll even add on, beyond just the academic centers and health systems that are there are also, New York City has a bustling startup scene, a health tech scene. So there are just so many opportunities getting your education in New York City to then set you up for a job right after you graduate.